Hey guys, this is Dr. K. Today we are going to be talking about the theories and models of nursing. So this is going to be for your professional role development course. It's NRS 2012. So first off, we're going to start talking about a theory versus a model. So a theory and a model are not synonymous, but we often use them interchangeably in healthcare and in the nursing field. So, a theory refers to a speculative statement involving some element of reality that has not been proved. So, an example of this would be the theory of relativity. We've all probably heard of that. So, it's a theory, so it's something that has been observed, it's a proposed idea or plan, but it's not been proved. So on the flip side of that, we have a model. So a model is a hypothetical representation of something that exists in reality. And the purpose of a model is to explain a complex reality in a systematic and organized type of way or manner. So, an example of this would be a hospital organization chart that shows the different interrelationships of the various like hospital levels of administration and things like that. These both help to explain and direct nursing actions. Like I said, they're not synonymous, but we often use them fairly interchangeably in the nursing practice. So, as we're getting started and kind of working through this lecture, I kind of want you guys to keep these questions in the back of your mind. So, what is nursing? What do nurses do? What are nurses? And what is health? As we kind of go through this lecture, we're going to talk a little bit more about all of these. But I just kind of wanted to throw those out there at the beginning so you can kind of keep them in the forefront of your mind. So the first theory that we're going to talk about is the systems theory. So the systems theory is an outgrowth of an innate intellectual process. So essentially, the human mind has a really difficult time comprehending large, complex entities or things as a single unit. So it automatically divides that into smaller, more manageable fragments, and then it kind of examines each fragment separately or independently. So, this is similar to the process of deductive reasoning, in which a single complex thought or theory is broken down into smaller, like interrelated pieces. Okay. So, a system by definition is a whole that functions as a whole due to the interdependence of its parts, and a set of parts connected to a function as a whole for some purpose. It functions due to the interdependence of its parts. I know that that's kind of a big mumbo jumbo, but that's just how your book defines it, so I left that in there for you guys. So, some key concepts, or really the one that's really big with this, is non-summativity. So, it's the degree of interrelatedness among the system's parts. So, the higher the degree of non-summativity, the greater the independence or interdependence of the components. So, higher degree of non-summativity, the greater the interdependence of components. A high degree of non-summativity is shown when a change in one part affects all the other parts in the whole system. And then all systems need some degree of non-summativity to function. So we have two types of systems. We have an open system and a closed system. These probably aren't very new concepts for most of you, but we're still going to talk about them. So, an open system, or in an open system, a completely open system, there are no restrictions on what information moves in and out of the system. But most systems have some control over the movement of information, energy, matter, um, all of those things that are around them. So this control is maintained really through a semi-permeable nature of their boundaries. So they set boundaries to kind of have a little bit of control over what goes in and what goes out in an open system. But a completely open system, there is no restrictions. But most even open systems have some type of buffer, if you will, of what can go and what can come. So, closed systems are ones that do not exchange data with the environment. So they are self-contained, they're slow to change, and some examples are going to be things like chemical reactions, rocks, social systems that just don't accept change, such as government entities that exist really only to like survive. So those are just some examples of a closed system. So open systems, most of them have a little bit of a buffer, but information is kind of freely exchanged. There's an ongoing dynamic exchange of data. Closed systems, everything's, as you probably guessed it, closed off. So that's about the biggest way or the best way that I can think to kind of break those down. So next we're going to talk about a couple key concepts. So we have input output channels and a throughput. So input is defined as any type of information, energy, material that enters a system from the environment through its boundaries, and an output is defined as any information, energy, or material that leaves the system and enters the environment through the system's boundaries. So the end product of a system is a type of output that is not reusable as input. Open systems require relatively large amounts of input and output, obviously, as you can imagine, because there's a constant continual exchange going on, like we talked about in the previous slide. So, a throughput, on the other hand, is a process that allows the input to be changed so that it's useful to the system. So, think about this, like for example, most cars take some form of gas, whether it's just regular gas, diesel, whatever, some kind of liquid fossil fuel, and that is their input. So, going to a gas station, if we go and we pour the gas on top of the roof of the car, it's not going to produce the effect that you want of making the car go, right? So if the fuel is put into the gas tank, it then goes to the carburetor or the fuel injection system. Then it goes to a spark plug, and then it burns and it creates the fuel and the energy, or it burns the fuel to create the energy and force that's needed to produce the desired effect of making the car go or have the vroom vroom juice, as I say. So that's just kind of the best example as I can think of for a throughput. And without the internal process or that throughput, um, obviously you don't have like useful form of energy. So, all right. So next we're going to talk about feedback. So you've probably heard a couple different types of feedbacks or feedback loops. So, feedback loops allow the system to monitor its internal functioning status so that it can either restrict or it can increase its input and output to maintain its highest level of functioning. So, a positive feedback leads to change within the system. And the goal is to overall improve the system with the change. So, for example, students in a classroom receive feedback from a teacher in several ways. It can be through direct verbal statements like, oh, hey, great job on that assignment, or good job on your test. Or it can be through exams and homework grades and things like that. The feedback itself is considered positive if it produces a change in a student's behavior, such as motivating him or her to study more, spend more time on assignments, prepare more, things like that. And then we have negative feedback systems, or just negative feedback. So, negative feedback helps maintain stability. It does not produce change. So, negative feedback does not produce change. It's not necessarily bad for a system, even though you think negative equals bad. It's not necessarily bad for a system, but when the system reaches its peak of functioning, negative feedback just helps to maintain that level. Similar to like when a person who's on a weight loss journey achieves the weight that they want to lose, they go on a maintenance journey, right? To help keep the weight off. It's a similar concept. This is just a diagram, little picture of all the things we just talked about. So we have the input. The input is what goes into the system. We have processing, and then we have output and feedback. So, okay. So next is the Roy adaptation model. So this was established by Sister Callista Roy in 1976. And the main goal of this model is to allow the client to reach his or her highest level of functioning through adaptation. The nursing models should address or define 4 different concepts. So it's person, environment, health, and nursing. And we're going to talk more about those right now. So a person or the client is considered the central element of the model. So it has both input and output. And because the client is constantly being affected by stimuli, adaptation is a continual process. Okay. So next we have environment, and it consists of all the factors that influence the client's behavior, both internally and externally. So we categorize environmental elements into 3 different groups. So we have focal, contextual, and residual. Focal are environmental factors that most directly affect the client's behavior, and it requires most of his or her attention. Contextual forms, contextual form the general physical, social, and psychological environment from which the client emerges or comes from. And then residuals are factors in the client's past, like their personality characteristics, past experiences, religious beliefs, social norms, things like that, that have an indirect effect on the client's overall health status. Okay. So we have behavioral responses can be either adaptive or non-adaptive. So that's pretty basic. So adaptive is just a coping process that allows the person to adjust to the stimuli or the input and maintain a state of health. Or they can be non-adaptive or non-effective, and the person is unable to cope with the stimuli and is in a state of illness. So, with nursing, how do nurses achieve their goal of promoting adaptation? So, think about it. We do it by manipulating stimuli. Okay. We do that through education, changing the environment, and altering the physiological condition of the person. So, those are just some basic things, how we manipulate the stimuli to help promote adaptation. So, we educate our patients. We can change the environment. We can, if they're in like a critical care setting and they're in the ICU, we typically try to keep the lights dim at night, and things like that. We try to change their environment to mimic as if like they were awake and everything was okay. And then altering the physiological condition of the person. We're going to do that through therapies, through medications, things like that, to try to help their physiological condition and get them better. Okay. So, where do nurses give nursing care? Wherever there's a person. um, Nursing, as you can probably guess at this point in life, is vast. There's a whole lot of different areas that you can go into. Nursing isn't just in a hospital. I work PRN for a home health company on the weekends and after hours. So, I'm going into people's homes and providing nursing care and doing assessments, sometimes giving antibiotics, Foley catheter changes, things like that. So it's not always just in the hospital. So we think about it and we're like, who's the object of nursing care? Nursing care is all encompassing. So it can be individuals, it can be families, it can be communities, society as a whole. Nursing care isn't specific just to one person, population, group. It's everybody, and sometimes that looks a little different. I know we think hospital based is very individualized care. We may have some family dynamics that we're dealing with as well. um, but also think about it from like a community health standpoint. You're educating communities and helping take care of communities, and society as a whole whenever you're in those kind of settings as well. Okay, so the Roy model and nursing process is what we're talking about. So this model fits really well with the 5 steps of the nursing process. I know that you guys probably already know all of these. So it's assessment, analysis, planning, implementation, and evaluation. So the primary nursing assessments are the client's behavior or the output. So basically, the nurse really should try to determine whether that client's behavior is adaptive or maladaptive in each of the 4 adaptational modes that we previously defined. So, some first level assessments of a client with pneumonia, for example, might be their temperature of 104, or if it's really high, or whatever their temperature is. A productive cough with like some thick, maybe green looking sputum. Chest pain, signs of weakness or physical debility, and the inability to bring in wood or something like that to put it in the fireplace, or sit and talk with friends. Things like that are going to be our first level assessments of a client. And then a second level assessment should also be made to determine what type of stimuli or input is affecting the client's healthcare status. So, talking about a patient with pneumonia, this might include a culture and sensitivity of their sputum, just to try to figure out what kind of bacteria they have so that we can put them on the appropriate antibiotics and things like that. And then we can further help the client to get better based off of those things. So, after you do your assessment, the nurse or you are going to analyze the data and arrange them and be able to make a statement about the client's adaptive or maladaptive behaviors. So, that's going to be you identifying the problem. So, in current terminology forms or terms, this basically is your nursing diagnosis. So, the problem statement is the first part of the 3-part of the problem, etiology, and then signs and symptoms formulation that overall completes their nursing diagnosis. So then we're going to move into the planning stage. So at this point, we are going to set some goals, within a week or by the end of my shift, things like that. Those are going to be like your goals that you set. What do you want the patient to be able to achieve? We're going to make a plan, set our goals, and then we're going to implement those goals. We're going to carry them out. We're going to do our interventions and things that we can do as nurses to help meet those goals. And then we're going to evaluate if our goals were met or not. And then if they weren't met, what can we do to make them more attainable or help the patient reach those goals? So this is just a picture. It's the health continuum. So we have illness versus wellness. So I kind of said at the beginning when we were talking about a patient and basically they can be in terms of health and really good health all the way perfect health, or they can be at the illness level, and this is where we start having to come in as nurses and do our nursing care. So next we're going to talk about the Orem self-care model. So this model was developed by Dorothea E. Orem, and it's based on the belief that healthcare is each individual's own responsibility. So the aim of this model is to help clients direct and carry out activities that maintain or improve their health or health overall. So the client is, again, the central part of the Orem model. And self-care is defined as the practice of activities that individuals initiate and perform on their own behalf to maintain life, health, and well-being. So self-care is a big component for the client with this model, for them to have their optimal functioning and of their health and for maintenance for life. So next with this model, health is going to be the other big component. So in this model, health is defined as the person's ability to live fully within a particular physical, biological, and social environment, achieving a higher level of functioning that distinguishes the person from lower life forms. So, quality of life is an extremely important element in this model of nursing. A person who is healthy, living life to the fullest, and has the capacity to continue that life through self care is really what we're trying to achieve. So, an unhealthy person is an individual who obviously has a care deficit. And this group of unhealthy individuals also includes adults with diseases and injuries. Young dependent children, elderly people, disabled people, they all fall into that category of unhealthy person. And the deficit really is indicated by the inability for them to be able to carry out one or more of the key healthcare activities. So, those activities can include things like air, water, and food, excretion of waste, activity and rest, solitude and social interactions, avoiding hazards to life and well being, and being normal mentally under universal self care. So if they're unable to achieve any of those or carry out any of those 6 different things on their own, they typically fall into that category of unhealthy person under this model. So, like I said, those are all the key healthcare activities that I just listed. There's 6 different ones. It's just there for you as a slide if you need it. So universal self-care. So it's a two-part concept. So the first type is the universal self-care, like I said, and it includes the elements commonly found in everyday life that support and encourage normal human growth and development, functioning, things like that. Individuals who are healthy, according to the Orem model, carry out the activities that are listed on the previous slide. You can check those out. In order to maintain a state of health. So, to some degree, all of these elements are necessary activities in maintaining health through self care. The second type of self care comes into play when the individual is unable to conduct one or more of the six healthcare activities. So, kind of like I said, and this is kind of just a little bit more in depth of what we were talking about previously. And it's the health deviation self care. So we had healthy versus unhealthy, and now we've got universal self care versus health deviation. So we can kind of see how those go together. So health deviation self care includes activities carried out by activities or by individuals who have diseases, injuries, physiological or psychological stress, or other health concerns. So, those activities, such as seeking health care at an emergency department or clinic, entering a drug rehab unit, joining a health club or weight control program, or going to a physician's office, are all going to fall into this category as well. So next we're going to talk about environment with the Orem self-care model. So environment is the medium through which clients move as they conduct their daily activities. So it's less emphasized in this model, but the environment is generally viewed as a negative factor in a person's health, mainly because environmental factors detract from that person's ability to provide self care. So, environments include social interactions with others, situations that have to be resolved, and physical elements that just affect the overall health. So, nursing. How does that go with the Orem's model? So, the primary goal of nursing in this model is to, you probably guessed it, help the client conduct self care activities in such a way as to reach the highest level of human functioning. So, if you've kind of noticed, there's a pattern. All of these models, our main goal is to help the client achieve basically the highest level of human functioning that they can. Because there are a range of levels with self care ability, this model, there's three distinct levels or systems of nursing care that are delineated, and it's based off the individual's ability to undertake those self care activities. So, as clients become less able to care for themselves, their nursing care needs increase. So, we start seeing wholly compensated care, partially compensated care, and supportive developmental care. So, wholly compensated care is a person who is able to carry out few or no self care activities. They are going to fall into that category. So, some examples are of clients who require the level of care. They can be comatose, ventilator dependent, in an intensive care unit. These clients are basically going to be what we call our total care patients, if you've heard that term before. They are going to be fully dependent and require total care from the nursing side. So, partially compensated care, clients in this category can meet some to most of their self care needs, but still have certain self care deficits that require nursing intervention. So the nurse's role becomes one of identifying these needs and carrying out activities to meet them until the client reaches a state of health and is able to meet the needs personally. So examples of this can include maybe taking care of a post-op patient who's had a hip replacement and they just need some help with doing their ADLs or activities of daily living. And they just need a little extra assistance. They can still do things on their own, like maybe brushing their teeth and stuff like that, but they need a little bit of help. Or maybe a stroke patient who's got some deficits because of the stroke. They need some assistance with their ADLs, but they can still do certain things to a degree on their own. And then we have supportive developmental care. So these are going to be clients who are able to meet all of their basic self care needs, and they require very few or no nursing interventions. So these clients fall in the supportive developmental category of nursing care, in which the nurse's main functions are to teach the client how to maintain or improve health and to offer guidance in self care activities and provide emotional support. So basically, this is where you are providing a lot of education. A lot of home health patients are going to fall into this category. Like I mentioned previously, I work PRN for a home health agency on the weekends and at night. Um, a lot of these patients require education. There is a knowledge deficit, specifically related to things like heart disease and diabetes management, things like that. So they are independent and can live at home, but they still need that reinforcement and that education. All right, so next we're going to talk about the King model of goal attainment. So the King model was developed by Imogen King, and it establishes healthcare goals for the client. So nursing functions in all three system levels are found in this environment. So personal, interactional, and social. So essentially, this is the practice of establishing healthcare goals for clients and then directing client care to meet the goals. All right, so the client is once again the focal point of the King's model. The client is viewed as an open system, and they exchange energy and information with the environment. A personal system with physical, emotional, and intellectual needs that change and grow during the course of life. So because of these needs, um, or because these needs can't be met completely by the client alone, interpersonal systems are developed through interactions with others, and that is basically how we help the client grow and change and meet their healthcare needs. So next we're going to talk about the environment. So the environment is a really important concept in the King model because it encompasses a number of interrelated elements. So the personal and interpersonal systems, or groups, if you will, are central to the King's concept of environment. So they are formed at various levels according to internal goals that are established by the patient or the client themselves. So we have personal systems, interpersonal systems, and then our social systems, like I mentioned earlier. So your personal systems at the most basic level. This is where an interchange takes place between two different people who have or share similar goals. An example of this would be a client nurse relationship. And then we have the interpersonal system. So at this level, this is more of the intermediate level of the interpersonal system, and it involves relatively small groups of individuals who share like goals. So examples could be like a weight loss program, like where people meet and have weekly meetings and they have like little small groups. And then our social system is going to be our highest level, and that's going to be a large, relatively big part of society. So the healthcare system, the government, and society in general are some important social systems. All right, health is going to be our next portion to this model. So, health is viewed as a dynamic process that involves a range of human life experiences, and health exists in people when they can achieve their highest level of functioning. So, health is the primary goal of the client in the King model. It's achieved by continually adjusting to those environmental stressors and setting and achieving goals for one's role in life. Anything essentially that disrupts or interferes with people's ability to function normally in their chosen roles is considered to be a state of illness. So, what does nursing look like in this model? So, the King model considers nursing to be a dynamic process and a type of personal system based on interactions between the nurse and the client. So during these interactions, the nurse and the client jointly, so together, they evaluate and identify the healthcare needs, they set goals, and those goals ultimately are going to fulfill needs and consider actions to take in achieving those goals. So, nursing, like I've said previously, is a multifaceted process. So that's going to include a range of activities such as the promotion and maintenance of health through education, the restoration of health through the care that we provide to the sick and injured, and preparation for death through care of dying. So the process of nursing in the King model includes 5 key elements, and they are considered to be central to all human interactions. So we have action, reaction, interaction, transaction, and feedback. So, action is going to be a sequence of behaviors involving mental and physical activities. Reaction is going to be the resulting behaviors produced by the process of action. Interaction is the client and nurse communicating together to establish goals. Transaction is a life situation in which perceivers and things perceived are encountered and entered into as active participants. And then feedback is just that change that occurs as the result of the interaction and transaction process. So that is how nursing plays into that model. So next we're going to talk about the Watson model of human caring. So this was developed by Jean Watson, and she used more of a philosophical approach rather than a systems approach. So it's defined as caring in a detailed and systematic manner. And its most important aspect of caring is establishing a helping and trusting relationship. So, you know that we always talk about build rapport, establish rapport with your patient. It's building that trusting and helping relationship with your patient as a nurse. So that's kind of where this stems from, or where that stems from. This is an attempt to balance the impersonal aspects of nursing care with the personal and interpersonal elements of care. So basically, we know everybody is human. We're just trying to balance everything out and build a relationship and rapport with our patients and say, hey, I get it. Like, I know that this is hard. Let's talk through it. Let me help you. So the concept of the client or the patient in the Watson model is developed closely with the concept of nursing. So the individuality of the client is a key concern. The Watson model ultimately views the client as someone who has needs, who grows, develops, all those things throughout life, and who eventually reaches a state of internal harmony. So the client is also seen as a gestalt or a whole entity who has value because of the inherent goodness and capacity to develop. So this gestalt or holistic view of the human being is a reoccurring theme in the Watson model because it emphasizes that the total person is more important to nursing care than the individual injury or the disease that the person is there for. So the environment in the Watson model is a concept that's also closely intertwined or related with the concept of nursing. So it's viewed primarily as a negative element in the healthcare process because it consists of those factors that the client has to overcome to achieve a state of health. So the environment can be both external, those physical and social elements, as well as internal psychological reactions that affect health. So, to be healthy, according to the Watson model, the individual must be in a dynamic state of growth and development that leads to reaching full potential as a human. So, as with other nursing models, health is viewed as a continuum along which a person at any point may tend more toward health or more toward illness. So, illness in the Watson model is the client's inability to integrate life experiences and failure to achieve full potential or inner harmony. In this model, the state of illness isn't necessarily synonymous with the disease process. So, if the person reacts to the disease process like in a way as to find meaning, that response is considered to be healthy. A failure to find meaning in the disease experience is what's going to lead to a state of illness. So Watson makes a clear distinction between the science of nursing and the practice of curing or medicine. She defined nursing as the science of caring, in which the primary goal is to assist the client to reach the greatest level of personal potential. So, the practice of curing involves the conduct of activities that have the goal of treatment and elimination of disease. The process of nursing in the Watson model is based on the systematic use of the scientific problem solving method for decision making. So, to best understand nursing as a science of caring, the nurse really should hold certain beliefs and be able to initiate certain caring activities. So, this is where our values and caring kind of come in. So, values are basic to the beliefs necessary for the successful practice of nursing in the Watson model. Um, they are the formation of a humanistic, altruistic system of values based on the tenet that people are inherently valuable because they are human. So, in addition, the nurse should have a strong sense of faith and hope in people and their condition because of the human potential for development. When it comes to caring, according to Watson's caring way, several activities are important in the practice of nursing. So these are going to include establishing a relationship of help and trust between the nurse and the client, encouraging the client to express both positive and negative feelings with acceptance, manipulating the environment to make it more supportive, protective, or corrective for the client with any type of disease process, and then assisting in whatever way is deemed appropriate to meet the basic needs of the client. So next we're going to talk about the Johnson Behavioral System Model. So this was developed by Dorothy Johnson, and she considers client behavior to be the key preventing illness or the key to preventing illness, I'm sorry, and to restoring health when illness occurs. So Johnson holds that human behavior is really a type of system in itself that is influenced by input factors from the environment and then has output that in turn affects the environment. So the client in this model is viewed as a behavioral system that is an organized and integrated whole. So the whole is greater than the sum of its parts because of the integration and functioning of its subsystems. So in the Johnson model, the client as a behavioral system is composed of 7 distinct behavioral subsystems, and those are listed right there: security, dependency, taking in, eliminative behavior, sexual behavior, self protection, and achievement. So, the first behavioral subsystem is the attachment or affiliate subsystem. Its driving force is security. So, for the most part, the type of activity that this subsystem undertakes is inclusion in social functions, and the behavior that is observed from the subsystem is social interaction. So, dependency is the second behavioral subsystem, and its main goal is to help others. So the primary type of activity involved in nurturing and promoting self-image, or the primary type of activity involved with dependency is nurturing and promoting self-image. So our observable behaviors are going to be things that result in activities of approval, attention, and physical assistance of a person. So with taking in, its motive is to meet the body's basic physiological needs of food and nutrient intake. So its primary activity is seeking and eating food. Eliminative behavior is its goal is removing waste products from the system. So the primary activity is going to be elimination. Sexual behavior is next, and it's the fifth element. The sexual subsystem has gratification and procreation of the species as its goals, and it involves the complex activities of identifying gender roles, undergoing sexual development, and participating in sexual activity. So it manifests itself in courting and mating behaviors. Self protection is the sixth behavioral subsystem, and it's an aggressive subsystem. Its main goal is self preservation, as one could probably guess. So, all of the actions that individuals undertake to protect themselves from harm, either internal or external, derive from this subsystem and are shown in actions towards others and the environment in general. And then the last subsystem is achievement. So, exploration and manipulation of the environment are the objectives of this subsystem. So, gaining mastery and control over the environment is the primary activity, and it can be demonstrated externally when the individual shows that learning has occurred and higher level accomplishments are being produced. So, health with this model, according to the Johnson model, a state of health is achieved when balance and a steady state exist within the behavioral systems of the client. So, under normal circumstances, the human system has enough inherent flexibility to maintain this balance without external intervention. But at times, the system's balance may be disturbed to a degree by physical disease, injury, emotional crisis, and it's going to require external assistance. So, this out of balance state is the state of illness. Environment in the Johnson's model is defined as all of those internal and external elements that have an effect on the behavioral system. So these environmental elements include obvious external factors such as air temperature and relative humidity, sociological factors like family, neighborhood, and society in general. And then the internal environment such as bodily processes, psychological states, religious beliefs, and political orientation. So, all 7 behavioral subsystems are involved with the client's relationship to the environment through the regulation of the input and the output. The client is continually interacting with the environment in an attempt to remain healthy and maintain that internal dynamic balance. So, in the Johnson model, nursing is an activity that basically helps the individual achieve and maintain an optimal level of behavior or state of health through the manipulation and regulation of the environment. Nursing has its functions in both health and illness. Nursing interventions to either maintain or restore health involve four activities in the regulation of the environment. So these are those four activities: restricting harmful environmental factors, defending the client from negative environmental influences, inhibiting adverse elements from occurring, facilitating positive internal environmental factors, in the recovery process. So, the goal of nursing is to promote the highest level of functioning and development in the client at all times. So, next we're going to talk about the Newman Healthcare Systems model. So, this was developed by Betty Newman, and it focuses on the individual and his or her environment, and it's applicable to a variety of healthcare disciplines apart just from nursing. So, drawing from systems theory, the Newman model also includes elements from stress theory with an overall holistic view of humanity and healthcare. So in this model, the client is viewed as an open system that interacts constantly with internal and external environments through basically that system's boundary. So the client system's boundaries are called lines of defense and resistance in the Newman model, and they may be represented graphically as a series of concentric circles that surround the basic core of the individual. So the goal of those boundaries is to keep the basic core system stable by controlling system input and output. So Newman classifies these defensive boundaries according to their various functions. The internal lines of resistance are the boundaries that are the closest to the basic core and thus protect the basic internal structure of the system. So the normal lines of defense are outside the internal lines of resistance. So they protect the system from common everyday environmental stressors. And then the flexible line of defense surrounds the normal line of defense and protects it from extreme environmental stressors. So the general goal of all of these protective boundaries is to maintain the internal stability of the individual. So, health in the Newman model is defined as the relatively stable internal functioning of the client. So, optimal health exists when the client is maintained in a high state of wellness or stability. In other nursing models, health is not really considered an absolute state, but rather a continuum that reflects the client's internal stability while moving from wellness to illness and back. So it takes considerable amount of physical and psychological energy to maintain the stability of the person who is in good health. The opposite of a healthy state is going to be illness, and it exists when the client's core structure becomes unstable through the effects of environmental factors that basically overwhelm and defeat the lines of defense and resistance. So those environmental factors, whether internal or external, are called stressors for this model. So the environment is composed of internal and external forces or stressors, as we've mentioned before, that produce change or response in the client. So stressors may be helpful or harmful. They can be strong, they can be weak. But they're classified according to their relationship to the basic core of the client system. So stressors that are completely outside the basic core are termed extrapersonal and are either physical, such as the atmospheric temperature, or sociological, such as living in either a rural or an urban setting. Interpersonal stressors are going to arise from interactions with other human beings. So, marital relationships, career expectations, and friendships are included in interpersonal stressors. So, those stressors that occur within the client are intrapersonal and include involuntary physiological responses, psychological reactions, and then their internal thought process. So, the nurse's role in the Newman model is to identify at what level or in which boundary a disruption in the client's internal stability has taken place. And then they are to aid the client in activities that strengthen or restore the integrity of that particular boundary. So the Newman model expands the concept of the client from the individual to include families, small groups, and community, or even society in general. So, based on the nursing process, there's 3 levels of intervention. We have primary, secondary, and tertiary care. So, the main goal of a primary intervention is to prevent possible symptoms that could be caused by environmental stressors. So, teaching clients about stress management, giving immunizations, and encouraging activity and exercise that help prevent heart disease are all examples of primary interventions. So, secondary interventions are aimed at treating symptoms that have already been produced by stressors. So, many of the actions that nurses perform in the hospital or in a clinic, giving meds, teaching clients with cardiac disease, things like that, fall into this secondary intervention category. And then a tertiary intervention seeks to restore the client's system to an optimal state of balance by adapting to negative environmental stressors. So, teaching a client how to care for a colostomy bag at home after discharge from the hospital is an example of a nursing activity at the tertiary level. So it basically occurs after the client has received a secondary intervention and offers support to the client so that he or she can continue to recover or prevent further deterioration in health. So that is the last slide of this lecture, and I hope you guys learned something new or even reviewed. So if you have any questions, please feel free to shoot me an email and I'll be glad to answer them. Thanks.